are back now with our sponsor, Arkansas Heart Hospital Bariatric Metabolic Institute surgeon, Dr. Samuel Bledsoe, joins us today to talk a little bit about what they do at the Institute. Welcome.
Well, thank you. Thank you for having me.
Yeah, and I should say welcome back to Arkansas. You're back home now, right?
That's right. I spent 7.5 years in Louisiana. Now we're bringing this back to the Arkansas Heart Hospital.
Awesome. Well, you know, I think we all hear about bariatric surgery, but we don't really know what that entails. So tell us what you do there.
Well, with bariatric surgery, what we do is we can manipulate the GI tract in the stomach a little bit so that people can have increased weight loss, and more importantly than even the weight loss is the resolution of medical problems that go along with obesity, specifically diabetes, high blood pressure, sleep apnea, high cholesterol. Those kinds of things respond very, very well to bariatric surgery.
So anyone who needs it, but you've been kind of focusing on those suffering from diabetes. Talk a little bit about that.
That's right. Recently, the American Diabetes Association has come out with new recommendations, and what they're recommending now is if your BMI is greater than 40, that you go straight to surgery if you have diabetes. If your BMI is greater than 35 and you have diabetes and it's not really well controlled, you also go straight to surgery. So whereas in the past we were doing surgery for weight loss and one of the fringe benefits was the resolution of the diabetes, now we're doing surgery specifically for diabetes, and one of the fringe benefits is the weight loss that goes along with it.
So these are new recommendations that have
These
just
are new
come
recommendations in 2017.
Right. So this isn't for someone who says, I want to lose 20 pounds or so, right?
No, ma'am.
Who is this for?
This is for somebody who has a weight of probably over 50 to 75 pounds and they're suffering from diabetes, or over 100 pounds and they don't really have any medical problems. Of course, we have to work with their insurance company and play by their rules as well.
Right. We want to put up that information really about what it takes to become a patient. Do you need to start with your personal doctor first?
That's a good place to start. We would like you to start with your primary care physician, start with them, and start working on diet, exercise, and behavior modification alone. And when you prove to yourself that you can't lose that weight and keep it off through diet and exercise, then we can be a good resource for you after that.
All right. A good idea to call with your insurance and find out about that, and to be sure that that will cover it. And then you can go online and find out a lot of information from the hospital.
That's right. And one thing that we can do to help you out as well is you can call our office and we can actually look at your insurance for you and not only decide and find out whether or not your insurance covers it, but also find out what sort of parameters they have and what sort of requirements they have in order for you to qualify for the procedure, because every insurance company is different.
And it can be so confusing.
It is very confusing.
You're worried about your health, and
That's
it's
exactly
hard to
right.
figure out all of those forms and all the insurance company stuff. So are there different types of surgeries that we're talking about?
There are. There's two main ones that we perform. The Gastric Bypass is one, and with diabetics it has about an 83% resolution rate for diabetes. 93% of the time we can at least improve the situation. And so we really do recommend that one for diabetics. At least they take a good close look at that one. The second one that we do a lot of, in fact we do more of this one than even the bypass, is the sleeve gastrectomy. It's a newer procedure. About 70 to 80% of the time we can cure that diabetes, and 90+% of the time we can improve the situation for the diabetic.
Those are high numbers.
Those are very, very high numbers. Most people don't know that.
Wow.
And that's why the American Diabetes Association is coming out with such a strong recommendation now, because of those very numbers right there.
So those people are getting off their diabetes medicine and longer lives, obviously.
Longer lifespan. You can add 5 to 15 years onto your life for an average diabetic. You can get off of your medications, and a lot of things, one of the things that people don't know is that this resolution of diabetes is often immediate, meaning we do the surgery, you get up off the operating room table, and you're not a diabetic anymore.
Wow.
So you go home on nothing. And of course, you know, it varies based on the patient, how bad their diabetes is, how long they've been a diabetic, but oftentimes those results are immediate.
Support services after that. I know that you want them to keep on a healthy lifestyle.
We want them to keep on a good diet and exercise program. We will help them. It's a little bit different than if you have a normal GI tract, and so we'll teach them how to use that tool that we've given them. We want to see them very commonly for that first year, and we really want to see them for the rest of their life. We want to keep them on that right track. We have support groups for them. We have psychological support for them. We have exercise physiologists, nutritionists for them. We have a lot of resources available for that person who needs that extra help.
That is awesome. Now, there's a seminar coming up that you can go to in person, or you can sit there at home on your laptop,
That's right. Yes, that's right. We do have an online seminar, and we also have one that's coming up at the hospital on March the 2nd.
Okay.
So this Thursday.
This Thursday. So do they need to sign up for that in some way?
It would be helpful if they signed up, just so we know how many people to expect. But if you don't want to, just show on up, and we'd be happy to give you all the information that you need so that you can make a very good decision for yourself.
It's a chance to ask questions. If it's for you, if it's for a family member, drag them in there, or just come yourself so you get the information. So that's at 6 o'clock. That's Thursday night.
Yes, ma'am.
And you can go to the Institute there and go in person or do it online, which is very neat. Thank you so much.
Thank you for having
we appreciate it. We'll see you back here again soon.